Hello, I'm Lisa Martin from HORIBA Veterinary, and I'm delighted to welcome you all to this continuing professional development webinar, the next in our ongoing series. We're very pleased to have you join us today. All of our previous CPD content on a wide range of veterinary subjects is available to watch back at any time in the support section of the HORIBA Veterinary website. Firstly, I'd like to introduce you to our speaker, tell you what to expect from the webinar and a little bit about HORIBA. We're very pleased to be working today with Madonna Livingstone, talking about head tilts in rabbits. Calling herself the practice geek, Madonna qualified from Glasgow Vet School in 2002 and is head vet and head of exotics at the ARC Veterinary Clinics in Glasgow, and she works with the 70 to 80% exotics caseload. Madonna also delivers all of the clinical exotic lectures and clinical practicals for Glasgow Vet School and is the nominated veterinary surgeon for all exotic teaching animals. She's also the exotics consultant for nationwide laboratories, has a diploma in parrot behaviour, has been published on rabbits, reptiles, parrots, ferrets, and has a textbook on rabbits and small exotic mammals being published later in 2024. Madonna speaks widely on exotic animal medicine and surgery to vets and veterinary nurses, and also to owner groups and exotic pet enthusiasts. She has a firm belief that all species deserve the same high level of care. Although her main interest is in exotic animal species, she also enjoys soft tissue surgery and behaviour of all species. When she's not working, Madonna can be found at home spending time with her husband, her 2 dogs, her 33 chickens, 10 ferrets, 4 cockatiels and 9 dwarf pufferfish at the last count. She also enjoys performing with a local professional dance troupe. HORIBA Veterinary sits within HORIBA UK with expertise in scientific testing, mass flow controllers, automotive emissions and air and water quality testing. HORIBA Veterinary and HORIBA Medical are a well-established provider of laboratory diagnostic instruments. We work with reference laboratories, academia, and general practice and referral settings. Our product range includes handheld meters running single parameter tests, higher capacity, user-friendly, automated chemistry and hemostasis systems, and the first fully integrated in-house PCR testing system. Here's a brief introduction. Our Aquatwin handheld meter range works in seconds on small sample volumes for individual parameters, including ionised calcium, pH and electrolytes, and all can be used patient-side. HORIBA offer benchtop systems for clinical chemistry testing, from occasional use to large reference laboratory throughput, offering highly cost-effective solutions and bespoke profiles alongside the facility for esoteric testing. We provide instruments also for blood gas and immunoassay testing. The Pocket Central PCR Analyzer is a unique, easy-to-use benchtop system which integrates seamlessly into your current lab provision. Now within reach of all veterinary settings, each step of the PCR process is fully automated and can be run by any trained member of the practice team 24 hours a day. Results are available in under 2 hours, speeding up diagnosis times, informing prescribing decisions, including responsible use of antimicrobials, and aiding patient management. The Pocket Central test range includes over 190 assays, enabling fast and easy testing for bacteria, viruses, parasites and protozoa across small animal, farm, equine, poultry, aquaculture and environmental work. PCR testing for all species is now accessible to everyone. Should you have any questions, please write your query into the box on the screen and we will cover as many questions as possible at the end of the webinar. If you're watching live and you would like HORIBA to issue you with a CPD certificate of attendance, please provide your name and email address in the chat box and we'll send it on in the next few days. You'll also have our contact details available at the end of the webinar should you have any further queries or if you're watching back. The event recording will shortly be available to view via the HORIBA Veterinary website, and you'll be sent details to enable access for you or any colleagues. So now I'd like to hand over to Madonna for her presentation on tilts, spins and tears, approaches to head tilts in rabbits.
Hi everybody, thank you to HORIBA and thank you to Lisa for that wonderful introduction and for asking me to speak this evening, and thank you to all of you for coming and listening to me. I can skip this slide, seeing as Lisa's already introduced everything that I do. I'm a bit of a workaholic because I'm lucky enough that my job is my hobby. But I am based in clinical practice, so I do see a lot of first opinion things as well as seeing referral work. Okay, so let's make a start. So rabbits, why should we be caring about rabbits? Any of you that have had the misfortune of listening to me before will be well aware of the fact that I'm a firm believer in the fact that the human-animal bond is not species-specific. It can be any type of animal. And rabbits are the third most popular mammalian pet in the UK. They're the fourth most popular mammalian pet in the United States, and they've been increasing in popularity worldwide as pets. And studies, in fact, every study that I've read, of which there are several because I am a geek, where they've looked at how the majority of pet owners view their pet. Well, the majority of the pet owners view their pet as a member of their family. So gone is the days where rabbits were considered disposable, or those days should be gone, I should say, and that pets, only dogs and cats, warranted high quality care. Owners are desperate, they're crying out for high quality care for all of their pets, not just the more familiar species. And head tilts is one of the most commonly reported neurological signs in rabbits. Okay, you can see here a patient in my clinic presented to me not that long ago. But now what? Well, you could start crying because it's not just the owner's tears, it's often the veterinary team's tears because they don't really want to have to be dealing with a rabbit, or they feel completely inequipped or ill-equipped or at a loss. But that's because the vast majority of us, when we're faced with a species that we think we know nothing about, we panic, we hit our panic buttons. And I'm forever saying to my students, don't hit your panic button. If you don't hit your panic button, if you remember that you're a veterinary professional and you go back to basics, more often than not, you can figure it out as to where to go. So we're back to the head tilt. We've calmed down, we've taken our finger off that panic button, and we've realised it's just a head tilt. Doesn't matter what it's in, it's just a head tilt. So as in other species, head tilt is highly suggestive of vestibular disease. Okay. And as in other species, we've got to warn the owners right at the beginning, even if we correctly diagnose it, or the underlying cause of the head tilt, even if we correctly treat it, there's always a risk of a residual head tilt. And the vast majority of animals with a mild residual head tilt cope absolutely fine, and it doesn't affect their quality of life. So first things first, go back to basics. We need to take our history, and most of history taken is not species specific, guys. It's not. Ease up off the panic button, people. Think about it. What do we ask when we're taking a history? We ask, what do you feed your pet? Where's your pet kept? How often is it exercised? What preventative health care do you practice? What is your pet behaving normally, and what is it that's worrying you? Is it eating normally? Is it urinating normally? Is it defecating normally? Rabbits can't vomit. They physically cannot vomit. So that is at least one question that we don't need to be asking. And then more specific questions to head tilts, well, the sort of things I'd be asking are, has there been any exposure to new rabbits? Now, that could be a new rabbit being brought into the house, but it could also be that the owner volunteers at a local rescue and therefore is being exposed to rabbit urine. And as we go to find out later on in the talk, that could potentially be a source of E. caniculi spores. Has the rabbit suffered any stressful incidents recently? That could be that there's been workmen in the house. If it's a house rabbit, it could be that there was a bond breakdown and the rabbits were fighting. It could be that they've tried to bond a new rabbit into the group. What's the rabbit's appetite like? What's the fecal output like? Not just is it pooing? We need to know, are they roughly the same number, size, shape, and colour as normal? What's the rabbit water intake like? Is it drinking the same, more or less? The speed of the onset. Has there any head shaking? Has there been any ear scratching? Has the rabbit displayed any rolling or spinning? Has there been any noticeable weight loss? And has the owner given any treatment in the house? Because a lot of owners will not volunteer this information unless you ask. And some owners, even when you ask, still won't volunteer the information. And age of the house, if you've got a house rabbit. And the relevance of that will become shown later in the talk. So different conditions, same presentation. So when I have a rabbit with a head tilt, what's going through my head is, okay, it's more than likely vestibular disease, but is it peripheral or central? Because you've got different differentials depending on whether it's peripheral or central. So with your peripheral vestibular syndrome, that's otitis media stroke interna. The reason I've said otitis media stroke interna is that you can't really differentiate between the two in rabbits. So you'll find that most resources will quote it like this. Another differential would be traumatic rupture of the tympanic bully, so some sort of accident. Aminoglycoside med ototoxicity, well, then that would become apparent from your history if the owner has been putting eardrops in that contain an aminoglycoside. Middle or stroke inner ear neoplasia, really, really uncommon. Is reported in the literature, but it is really, really uncommon. And idiopathic vestibular disease is listed in the various lists of differentials for peripheral vestibular syndrome, but I have absolutely no information on how common it is because I couldn't find anything in the literature. So, central vestibular syndrome differential diagnoses. Well, your infectious causes would be fungal, E. caniculi, and when I get to the section on E. caniculi, I'll explain a little bit more why I called it a fungal infection. Then we can have bacteria, so Pasteurella maltosta, staph species, E. coli, Pseudomonas, Listeria. All of them could cause infection in the brain or sepsis. Protozoal infections, like Toxoplasma gondii, viral, human herpes virus 1, and rabies. Rabies not being in the UK, or parasitic, and I'm not going to try to pronounce that because I'll just make an idiot of myself. That's also not in the UK, that's a worm from raccoons. But common things are common, yeah? So Toxoplasma, yep, it's got to be on our differentials, and we can check for PCRs for that. Or we can do antibody titers. But your viral causes, human herpes virus type 1, really rare to cause central vestibular syndrome. And of course, the raccoon worm, really rare to cause it, but it is recognised. Non-infectious causes of central vestibular syndrome, lead toxicity. Now, this is where the age of the house comes in, because if you have an old house, then the rabbit has been chewing the skirting boards. Very few people strip back their skirting boards of paint before they repaint them. So a lot of the older paints contained high quantities of lead. If the rabbit has been chewing the skirting boards and ingesting any of the flakes of paint, then lead toxicity is or has to be included in your differential list, and certainly blood can be sent off to the external laboratories to check lead levels if that is something that's going to be concerning you. Cerebral infarcts, hepatic encephalopathy, lymphosarcoma. And these are all options for your non-infectious causes. In my experience, the most common cause is otitis media stroke interna, followed by E. caniculi. And that might vary by geography. And the reason I say that is that I have colleagues that are down south, and their experience is the other way around. They see more E. caniculi than otitis media stroke interna. But I suppose another way of saying that is that that is going to be your top two differentials as to what's causing these head tilts and the kind of conditions that you need to be thinking about ruling in and ruling out. And we have to remember that the rabbit's quite likely going to have comorbid, partly I put the wrong teeth in for this presentation. The rabbits will more than likely have comorbidities, and it is of course possible that they have both E. caniculi and otitis media stroke interna. So other differential diagnoses of clinical signs, well, paresis, plegia, ataxia, well, depends on what limbs, it's just the same as dogs and cats. So if we think on our clinical exam, focal spinal disease can cause it, or disease anywhere along the cerebral brainstem spinal axis if it's all four limbs, for example. And impairment of voluntary motor control of the limbs where we're localised just to the spine and we think it's not due to any central issues, well, that's going to be spinal infarct, vertebral scoliosis, vertebral fractures. We know in vertebral fractures, although we think that we should obviously pick up on that from the history, owners aren't with their rabbits all the time, and it is crazy what things can happen to rabbits, and they hide it until later on when it actually becomes apparent that there's an issue. So history of no history of trauma does not mean there has been no trauma, it just means it's not been witnessed. So before we've taken our history, but before we touch the rabbit, we need to watch the rabbit and see what it's doing, first of all. Some owners will have taken videos, which is fantastic. I love it when owners bring me videos so that I can watch them. So hopefully this should be playing for you just now. So this is a rabbit that's circling. And there's a little bit of head nystagmus there because you can see it's shaking its head back and forth. It's a lop-eared rabbit. Okay, so that's other clinical signs associated with vestibular disease. If the rabbit is still bright and eating, well, some sources report it's much more likely to be bright and eating with E. caniculi compared to otitis media stroke interna, which makes sense, I suppose, because otitis media stroke interna would be a lot more painful. Don't be caught out by normal scanning behaviour. So if any of you are aware of this, this is common in REW, stands for red-eyed whites. So here is a video of scanning behaviour, and that's considered normal for a lot of rabbits. Although it's common in red-eyed whites, it can be seen in any animal, any rabbit, sorry. It's not sudden onset. So the owner should be aware of the fact that their rabbit does this occasionally and has done it occasionally since the minute they got their rabbit. Okay. And there's no nystagmus associated with it. So it's considered a normal abnormality. As opposed to head nystagmus, which I'll play this video for you here. There's a rabbit in my clinic here. Whereas the head nystagmus, the rabbit's fast and slow phase matches up with the ocular nystagmus. Okay, it's a bit hard to tell from this video, but that rabbit was showing signs of nystagmus. But can you also see that we've got a right-sided facial grimace? Okay, And that right-sided facial grimace straight away tells me that we've got a peripheral vestibular syndrome there, because the facial grimace is not associated with central, because it's the facial nerve that's irritated. Okay. The owner will notice, or should notice hopefully, a sudden onset difference, whereas your scanning behaviour, the rabbit will have always done it. With this kind of rabbit, or this kind of nystagmus, the owner will hopefully notice a sudden difference. Sorry, I'm really getting wrong teeth in today. This particular rabbit is a red-eyed white. This particular rabbit always did scanning. However, the owner noticed that the scanning was different to the normal way of doing it. Yes, not every owner is going to be so on the ball, but a lot of the rabbit owners that I interact with, even the first opinion ones, really spend a lot of time with their rabbits, and they're quite invested in these subtle signs. Another form of head nystagmus, so you can get this kind of almost rotary type of head nystagmus, and you could also see that there was no facial grimace, and it's a little bit more obvious there that we had ocular nystagmus. Other clinical signs that might help localise is mentation and quadriplegia. If we've got poor mentation, severe mentation differences, then it's probably going to be a central problem. Yes, rabbits that are in pain might be a bit duller than normal, but the rabbit's going to be in agony before it's going to affect the mentation. And other subtle signs that can help with our differential diagnosis list are things like head shaking. So this rabbit shakes its head because it's got an itchy ear, and then it falls over and it spins. Okay. So as soon as I see that, I want to check in that rabbit's ears and consider diagnostic imaging, as we'll go on to. So we've watched the rabbit, we've watched our videos, now what? Okay, now we're going to do our full clinical exam. Rabbits are a prey species, and they have evolved to hide illness. And when everything is food for something else in the wild, so if you've evolved to be food, then you've evolved to have an absolute requirement to escape predation at a split-second notice. Now, no animal likes a slippy surface, but if you're a prey species that has an innate requirement to escape predation, you cannot do that on a slippy surface. That is why prey species are much more likely to panic on tables. If they panic, they're more likely to kick out awkwardly and fracture their spine, or fracture a limb, or injure the handler. Okay, so that is why I always have a blanket or a towel to provide some grip, just to help the rabbit feel a little bit more secure and a little bit less stressed. And please remember, guys, they're just walking body systems in a different wrapper. It's still a skeletal system. We know that vertebrates all have the same anatomical and physiological pain pathways. Just because they don't show it in an innately human way doesn't mean they're not feeling it. It's just eyes, it's just a respiratory tract, it's just a set of ears, it's just dentition, it's just an oral cavity, it's just skin, it's just genitalia, it's just abdominal contents, it's just a heart, it's just a respiratory tract. And certainly if you start to think down those routes, hopefully it makes it a little bit less scary. And it will also mean that when you're performing your clinical exam, you're more likely to pick things up because you've released your panic button a little bit. Please make sure you do a full skeletal pain check. Wild rabbits are lucky to make it past 1.5, 2, and rabbits have only been domesticated for about 500 years. So the evolutionary pressure on rabbits was to move quickly, breed quickly, and breed often to replace yourself, but not for a robust skeleton. And we know that if we take a wild rabbit out of the wild and raise it in captivity, they can live 9 to 10 years. We know the average lifespan for pet rabbits is 8 to 12 years, and the eldest one I ever treated was 19, and I think the record was 21 or 22. But because the evolutionary pressure was not for a robust skeleton, I am frequently diagnosing osteoarthritis and pain skeletally from a year onwards, and that can be radiographically as well. So do a full skeletal pain check, just the same way you would do with more familiar species, ensuring that you do range of movements in all 4 limbs. And if you're having to put more pressure behind one limb, behind, say, the right elbow compared to the left elbow to get them to extend the limb, then the limb that you're having to put more effort behind to get to move is probably down to pain. So when I'm assessing for facial grimace, I tend to, with any clinical exam, I start at the front and I work my way back. So I'll have had a quick look at the incisors, I've looked at the nostrils, I look at the eyes, and then I like to palpate around the base of the ears, which I'll go into in more detail in a few slides. But I then like to do my full skeletal pain check. And for that, I start with range of movement of the neck, which is a little bit more difficult to do with head tilt rabbits. So if it was a rabbit presenting with severe head tilt, as opposed to just a mild head tilt, or indeed if it was torticollis, I would assess by kneeling down in front of the rabbit and visually looking at face on, because I'm looking for the symmetry of the upper lips. Okay. The reason this rabbit has yellow here is because I had fluorescein in its eyes, checking its nasolacrimal ducts. So we're looking for that symmetry of the upper lips. We want to check for the presence of a blink, especially if we've got asymmetry of the upper lips, and we can do that by using a moistened cotton bud to check for a palpebral reflex or corneal reflex, because if we've got a facial grimace, that's a sign that we've got facial nerve neuritis, and that can lead to a neuropathy where they cannot blink. So here's Walter, one of my patients, with a very, very mild right-sided facial grimace. And Walter is a fantastic wee rabbit, and I first met his owner because she had been to her vet several times, and she kept saying, there's something wrong with my rabbit's smile. And the vets would examine his mouth, look in his teeth, and say there's nothing wrong with his teeth, he's fine. And then she would go away again, and she'd come back and go, he's just not quite right. I can't put my finger on it, but I know he's not quite right. And there's something wrong with his smile. And the vets would look at his teeth again. So I think what was happening is that the vets were panicking a little bit and thinking, right, what do I know about rabbits? They get dental problems and they go into cutastasis. But we don't smile with our teeth. We show our teeth when we smile, but we smile with our lips. And what the owner was meaning was his lips were different to normal. So when I knelt in front of him, and then when I did his skeletal pain check and I looked at him, I could see that we've got an asymmetry of the lips there. And I said, yeah, he's got a facial grimace. He also then had an ear-based swelling, which I'll go into in more detail. And the facial grimace was in the same side of the ear-based swelling. And the owner burst into tears because she was so relieved that there was something wrong, not because she wanted there to be anything wrong with her rabbit, but if there's something being found that's wrong, then hopefully then we know what to do about it. So the facial grimace is associated with facial nerve irritation. Okay, I've already explained about the cotton bud. And we do need to warn that even though this might be the first sign that we see, it can actually progress into full-blown peripheral vestibular syndrome. And here's another wee rabbit with a much more obvious left-sided facial grimace. Nasal discharge or signs of upper respiratory tract infection increases the likelihood of bacterial otitis media stroke interna because it can tract up the eustachian tube to the inner ear. But because rabbits are obligate nasal breathers, they keep their nose really clean. So you can see, hopefully you can see that there is slight matting or wetting of the fur on the left nostril, below the left nostril compared to the right. The right side nostril looks much fluffier. But rabbits are snotty little school children. If they have a runny nose, they rub their face. So I always check the inside aspects of their front legs for any dry discharge. And that makes complete sense for an obligate nasal breather, because if you have to breathe through your nose, anything that's coming down your nose, you're going to want to wipe it away. So you will only see a nasal discharge at the nose if it's really severe. So always remember just to check the inside of their front legs. And I often do that as I'm talking to the owner, and I just run my thumbs down the inside of the front legs to feel for any discharge there. We can tell owners that the facial grimace may resolve, stroke improve with treatment, but it might not. This particular case, it did resolve. It didn't fully go away, because you can see that in the picture on the right, the left-sided upper lip is marginally higher up than the right upper lip. Other clinical signs that you'll find during a clinical exam that might help localise. Well, it's quite common for owners to say that their rabbit's not scratching its ears. So I always check the dorsal aspect of the pinny, because if they've been scratching, you'll tend to find an oval bald spot, and that's just where the back leg is, or sorry, the back foot is hitting. Sometimes it's got dandruff on it, sometimes it hasn't, sometimes it's just an oval area of alopecia. And then, of course, you can have a look in the ear, because if the rabbit's got lots of ear mites, for example, then it could be that we've got an otitis externa that is then progressed on to the otitis media, stroke interna. And if you remember, I mentioned about palpating the base of the pinny, just right where it attaches the skull. And I do both sides exactly at the same time, because I'm feeling for any asymmetry there. And what's quite common in lop-eared rabbits is you get this ear base swelling. But because of the lop, when the rabbit's ear flops over, it's really, really easy to miss unless it's specifically sought for. Now, this rabbit on the left has been prepped for surgery, so it's been shaved up. So you can see quite an obvious bulge there. It's quite commonly referred to as ear-based abscesses, but actually an oral diverticulosis is a much more accurate term, because what it's caused by is the genetic defect that results in softening of the cartilage and causes the ear flap to fall over, means that we get a much narrowed ear canal. So the normal wax can struggle to get out, okay? And then because it struggles to get out, you get it building up. And then you get increased humidity, you can get the delicate tissues then become inflamed, you can get kissing ulcers, you can then get otitis externa, and it keeps building up, and then you get bacterial infections, secondary bacterial infections, then you get pus formation, and rabbit pus is quite caseous because they lack the lysosomal enzyme to produce runny pus, and it's painful. Have any of you ever had an ear infection? Because I have. I used to get them all the time as a kid. Now, imagine that ear infection is so bad it stretches your ear canal. It actually causes the soft tissues to stretch and form a pocket of pus and wax. How painful must that be? So it's completely understandable why, if that pocket can cause the soft tissues to stretch, then it really isn't a surprise it can cause rupture of the tympanic membrane and progress on to otitis media, stroke interna. So for me, if I've got a ear-based swelling on the same side as the direction of a head tilt, because we know that if you've got a head tilt due to otitis interna, the tilt is going to be to the direction of the otitis interna. So if we've got a right-sided head tilt and we've got a big problem with an ear-based swelling, then that is going to be highly suspicious that we're dealing with otitis media, stroke interna. And we have to remember that this is an anatomical issue. So if it is severe, once we get the rabbit recovered from the initial presenting signs, then we're probably going to be looking at some surgical correction, which you are all more than capable of doing for this type, because this is a partial lateral wall resection once it's healed up, to allow the wax to just come out the side of the head rather than try to migrate up the ear. Okay. We're going to check for corneal ulceration, especially the most dependent eye, so the lower down eye. It's just an eye, guys. Use fluorescein. Just we diagnose eye ulcers just the same in rabbits as we do with dogs and cats. If the rabbit is spinning, it's much more likely to be prone to trauma, or if you've got that facial neuritis. And loss of the blink due to the facial nerve irritation, you're going to get exposure keratitis too. Is there any urine staining? Of course, we've already listened to the heart, listened to the lungs, palpated the abdomen to check for signs of abdominal masses, is the animal hydrated, that kind of thing. Urine staining is really commonly due to spinal, hip, or stifle pain. And the reason for that is rabbits pee with their butt tucked up and back, and they shoot the urine backwards. That is really difficult to do if you have pain in any of those joints. Now, guys, all be thankful that this is a webinar and I'm not lecturing live, because when I'm lecturing live, but I'm not in person, because if I'm in person, I like to demonstrate the positions that rabbits take or adopt when they're passing urine. So you've at least escaped that traumatization. But it's not difficult then to imagine why they don't do that properly, and they're more likely to get this urine staining and progress to urine scald. But if you've got pain due to degenerative joint disease or disc disease, then you're not going to posture properly or as often to pass urine. But not only that, you're not going to fully empty your bladder each time. Rabbits, we know, absorb every scrap of calcium from their diet and pee out what they don't need. That's a normal physiological thing for rabbits to do. So their urine is always full of calcium sand. But if you're not emptying your bladder properly each time, then your urines become more concentrated, it gets supersaturated with the calcium sand, then you get precipitation of the calcium sand, then you get sludgy bladder. Okay, so sludgy bladder is often due to undiagnosed osteoarthritis or spinal pain. And then that in itself, because you've got a bladder full of calcium sand or even bladder stones, means that we've got bladder pain. We can get atony of the bladder because it gets stretched, and that's more likely going to lead to dribbling of urine and urine incontinence and signs of staining or scald. However, it could also be down to paresis of the hind legs, so the rabbit can't adopt the right posture, and E. canicula's got to be on the list too. So, how do we make the diagnosis? We've done our clinical exam, we've taken our history, we've watched all the owner's videos, we've watched the rabbit. One of the best diagnostic tests that we can do is a thorough clinical exam. Okay, and certainly I know I've been guilty of forgetting about that in the past, so I like to take the opportunity just to remind us, you cannot beat a thorough clinical exam. In an ideal world, we want to perform comprehensive biochemistry, profile and hematology, and you can run it in-house. They're just mammals. You can just use the same machines you run your dog and cat stuff on. Okay, can make it a bit more challenging for interpretation. However, the vast majority of suppliers of your lab equipment now will have reference ranges calibrated for their machines for rabbits. So you can just message them. Alternatively, there's various textbooks available. A species-specific thing to be aware of is it's really rare in rabbits to have an altered total white blood cell count. Really rare. Like in 22 years of dealing with literally thousands of rabbits. I think I've seen it in 3 rabbits. Okay. So if we've got a lowered or a raised total white blood cell count, that should always be considered significant. What we tend to get is a change in the differential. In adults, adult rabbits should always have a ratio of 1:1 of their heterophils to their lymphocytes. Heterophil is just another word for rabbit neutrophil. Alterations in that ratio between the heterophil and the lymphocyte indicates chronic stress or disease. But remember, chronic pain is chronic stress. I have seen cases where of chronic pain that when I treat them with multimodal analgesia and then recheck the hematology, that differential ratio goes back to normal. And E. caniculi will not cause raised eosinophils. Okay, so just don't get caught out with that. So we've done our blood tests, our biochemistry and hematology in an ideal world. And then we're going to go on to some diagnostic imaging because we've got to try and figure out, are we dealing with otitis media stroke interna or econic? Yes, CT scanning is so much more sensitive at detecting otitis media stroke interna, but it is much more expensive. Okay, it is not going to be in everybody's financial grip. It is not always going to be available just by geography. So we need to be aware of that. And radiographs might be adequate. They might be completely adequate. The same study that showed that the CT was 97% sensitive also showed radiographs were 79% sensitive at detecting it. Okay, so yes, it's not as good, but if CT isn't an option, then we should at least consider doing our radiographs. And in severe cases, conscious might be diagnostic. This is rabbit in my clinic, and you can see the difference between the tympanic bully is marked because the tympanic bully is usually gas-filled, but you can see this rabbit had torticollis, so just took a quick conscious x-ray, and one is a whiteout essentially. If I've got the animal sedated, the best positioning is a VD skull radiograph for assessing tympanic bully. And we want to carefully examine and compare both tympanic bully. Healthy bully are gas-filled, they're symmetrical, the bone is thin. So these are the tympanic bully here. And subtle changes may be significant. So normal radiograph on the left, the right-hand side of the screen, you can see that the left tympanic bully, I'm hoping you can see my mouse cursor when I'm wiggling it about, is more radiopaque than the one on the right. Okay, so if you've got a rabbit with a left-sided head tilt and the left tympanic bully is more radiopaque than the right tympanic bully, that is highly suggestive of otitis media stroke interna. And again, radiograph on the left is normal, radiograph on the right is actually Walter, who you met earlier in the presentation with the really mild facial grimace, but you can see that his tympanic bully on the left, I've cut off my left and right here, but you can see the tympanic bully here on the left is dissolved away from infection. Okay, and the eagle-eyed ones amongst you will hopefully be able to see that we do have an increased radiopathy here as well. This was after some treatment, medical treatment that he received. So this is it starting to resolve. Okay, so let's do a quick run through E. caniculi. It was first detected as an infectious agent in rabbits in 1922. We're 102 years on from that, and it's still an absolute swine to diagnose, guys. It really is. It was previously classified as a protozoal parasite, but it's now been reclassified as a microsporidia. Actually, it's classed as a microsporidia being an intracellular fungus, okay? And it's got chitin in something else. And there's different strains of E. caniculi. We've got strain 1 that affects rabbits and humans. We've got strain 2 affects rodents, and strain 3 affects dogs and humans. It's got a direct life cycle, both horizontal by either ingestion or inhalation of spores. So inhalation via spores spread in the urine, or ingestion via spores in feces and urine. And vertical through the placenta. Ubiquitous exposure. And this is what complicates things sometimes, because depending on which country it is, the exposure is anywhere between 52% and 83.6% of rabbits. Clinically normal rabbits, 52 to 83.6% of them will have been exposed to E. caniculi and may be seropositive because of that. It is potentially zoonotic. Immunocompetent humans, very unlikely to get it. So really it's people like chemotherapy patients, people on immunosuppressive drugs, people that are HIV positive, very young, very old. So anybody that is immunocompromised, we have to bear in mind that there is a human health hazard. The spores are really resistant in the environment. They can last for 4 to 6 weeks at 22 degrees C. And kill off the spores in the urine. So if I'm in the clinic and I've got rabbit urine on my table, or I've got rabbit urine in the ward, 70% ethanol, now surgical spirit is 70% ethanol, it kills the spores within 30 seconds of it being touched. But 0.1% bleach needs 10 minutes of contact time to kill those spores. So even if you wiped your consultant room table down with bleach, diluted bleach, in theory, you still can't put another rabbit on that for 10 minutes in case you're exposing the next rabbit to E. caniculi spores. Okay, so that's why I tend to keep a bottle of surgical spirit in my consulting room and in the wards, because if I'm clearing up rabbit urine, I want to wipe it down with surgical spirit because I know that it's a 30-second contact time. The predilection sites for E. caniculi are brain, kidney, lungs. The lens tends to be in utero. However, there was a paper in 2019 that showed it might be get into the lens, mechanisms unknown, but it might get into the lens postnatal and myocardium. And this is the real frustrating part. The rabbit's immunological competency determines the course of the disease, and we can't tell that just by looking at them. Because your immunocompetent rabbits will usually have subclinical disease, so they're usually carriers with no overt signs or really mild signs of disease. But your immunocompromised patients will often present with overt clinical signs because they've got disseminated infections. Okay. The clinical signs are varied. So your neurosigns, you'll have central vestibular signs, hind limb paralysis, urinary signs, urinary incontinent, urinary scald, polyuria, polydipsia. But remember that rabbits that are in pain anywhere will be polydipsic. Okay, that is regularly seen with rabbits that are in pain. Ocular signs, cataract formation and uveitis. Non-specific signs are lethargy and weight loss. But one study did show that 60% of rabbits develop clinical signs associated with E. caniculi 72 hours after a stressful event. So this is why in our history taking we're asking about potentially stressful events. Because if we got an immunocompetent rabbit that's subclinically affected, and then we add stress into the mix, that causes immunocompromise. The immune system no longer suppresses the parasite, the spores replicate, we get ruptured cells, that leads to inflammation, then we get our clinical signs, because it is not the organism that's responsible for the clinical signs per se, it's the host response to it. So we get chronic granulomatous inflammation due to the presence of the organism. Okay, and the organism being Encephalozooin caniculi. So how do we diagnose it? It is challenging, and that's an understatement. The more I learn about encephalozoo caniculi, the more frustrated I get. Okay, so there's a rabbit's lateral saphenous vein, which is a beautiful vein for pulling blood from. Why is ante-mortem diagnosis challenging? Well, the severity of the inflammation seen histologically does not mirror the severity of clinical signs. So you can have, on post-mortem examination of the brain, for example, you can have really severe inflammation in rabbits that have no clinical signs. The level of the antibody titers does not mirror level of infection and does not confer any protection. So just because they've got high titers doesn't mean they're protected. Okay. And actually, one of the ways of diagnosing it is by a diagnosis of exclusion. We must rule out the other differential diagnoses before we can be sure that it's due to the disease is due to encephalozoo caniculi. Because another frustrating thing about encephalozoo caniculi is that the target organs will have inflammation in them, so they've been compromised by encephalozoo caniculi, and then another condition comes along and actually causes the clinical signs because the organs were already compromised. But it wasn't actually encephalozoo caniculi that caused the animal to have the clinical signs. It just caused them to be worse. So what do we do then? Multiple studies recommend paired IgM and IgG, titers 3 weeks apart. That's great if money's not an object. But the problem is a positive IgG does not mean E. caniculi is the cause of the disease, because all it means is exposure. And some rabbits will have high titers for life for IgG once they've been exposed. It could mean it is an active infection, or it could mean it was a latent infection that is relapsed. Okay, so if you're not confused by now, I'd be amazed, but hopefully it will all become apparent. A positive IgM, however, indicates an active infection, but this holds true for immunocompetent rabbits only, because if you've got an immunocompromised rabbit, it might not be producing antibodies properly for us to measure. But if we have two completely negative IgM and IgG titers 2 weeks apart in a rabbit that is displaying neurological signs, so full-blown neurosigns, it does confirm that E. caniculi is very unlikely. Okay, but you've already had to wait 2 weeks. We've got E. caniculi affects the kidneys, and this is a post-mortem picture of fibrosis of the kidneys. But see, in all honesty, guys, it doesn't often cause them significant renal impairment. In Harcourt, Brown and Holloway 2003 looked at 87 pet rabbits with clinical signs of encephalozoo caniculi. 7 of those 87 rabbits had signs of renal impairment, but only 3 had raised urea creatinine, okay, 3.5%. How else can we try and figure out its E. caniculi? Well, we can do urine PCR for spores, and HORIBA actually do a pocket central PCR benchtop analyzer that can do this. But we do need to be aware that there are some drawbacks for doing it, because the spores are only shed intermittently. They're shed between day 30 post-infection and day 98 post-infection, but they're not shed every day. So we do advise pulling a urine sample for at least 3 days. False negatives potentially can be quite common, because the rabbits may not be shedding for those 3 days you've pulled the urine. However, a positive is great, because a positive means that there's definitely an active infection. So that's when it comes into its own, because a positive PCR says, yep, this animal has an active infection of encephalozoo caniculi. However, it doesn't mean that's the cause of the neurological disease. We still have to rule out otitis media, stroke interna. The definitive diagnosis of E. caniculi is only able to be done by histological findings on postmortem or renal biopsies in theory. Not that I'm recommending doing renal biopsies in these animals, but presumptive diagnosis of E. caniculi can be based on the relevant clinical signs, exclusion of all the other underlying causes, elevated IgM, IgG, and or positive PCR urine. But the good news, there is good news, guys, is that much of the treatment is the same regardless of cause. Okay, so the treatment of vestibular disease, the vast majority is exactly the same. We want to be given midazolam or diazepam as muscle relaxants. It also reduces stress because we give these drugs by injection. It reduces stress because a lot of these vestibular signs, especially the spinning and the circling, worsen with stress. We want to be giving analgesia, non-steroidal anti-inflammatories, my preference being meloxicam, 0.6 to 1 mg per kg twice daily, because these animals are going to be in pain, and we know that a lot of the disease is caused by inflammation, both diseases. So we want to reduce that inflammation. Paracetamol, acetaminophen, I can't pronounce it, sorry guys, in America and Canada, works really well as part of a multimodal technique of approach to analgesia. So it's usually I'll go in at 20 to 25 mg per kg twice or 3 times daily. Meropitant is an antiemetic. We all know that. We give it to dogs and cats. However, in dogs and rats, it's been shown to have an isoflurane sparing ability. So we do think it targets pain. There is conflicting information out there, but at 2 mg per kg. But we think that the reason the information in rabbits is conflicting is that 2 mg per kg is too low. So I currently use 4 mg per kg by injection for meropitant. That helps skeletal and visceral pain. But just because the rabbit can't vomit doesn't mean it can't necessarily feel nauseous. Tramadol works quite well as an analgesic in rabbits, 10 to 30 mg per kg, 2 to 3 times a day. If I have severe neck pain or if I have facial grimace, so I know that I've got that neuritis there, I'm going to go in with gabapentin, start at 10 mg per kg, 2 to 3 times daily, go up to 30. I've only got a few slides more, guys, so and get the owners to massage the neck muscles as well. It gives the owners something to do, but with the rabbit having its head in a completely abnormal position, that's totally altering its center of gravity. That's going to have a knock-on effect to the rest of its joints, and it's because its body is going to be moved in ways it wasn't designed to move, so that's going to cause pain too. But just massaging some of those trigger points and knots out of the neck muscles, providing the rabbit is not getting overly stressed by it, is useful. Acupuncture, we do a lot of acupuncture in the clinic. My work wife, Dr. Chrissy Green, does it. She's a trailblazer in acupuncture and exotics, and it's really good as part of a multimodal approach. And it works by stimulating endogenous opiates. We know that. There's lots of research in it. In fact, if you give naloxone, it reverses the analgesic effect of acupuncture. It stimulates the fast pain fibers, which shut off your slow pain fibers, and your slow pain fibers are for your chronic pain. Stemetil, which is marketed Stemetil in the UK, can be used for vertigo or vestibulitis in people, and nausea associated with it, and that can be really useful. And we grind it up because it's in tablet form. We grind any of these tablets up and dissolve them in a known quantity of water so we can get a mg per ml solution. But in America, they tend to use meclizine for the same thing. Okay. And ocular lubricants, just to make sure that the eye stays moist. So we want to do supportive care. I mean, look at the size of the veins on the pinny there, guys. The lateral ear vein is huge in rabbits, and it's one of the easiest IV lines you will ever place. Because one of the most annoying things I ever find about putting an IV line in is you go through the skin and the vein disappears, it bounces away. Cannot happen in Pinny. Can't happen. It's super glued down. It's a thing of beauty. So if the rabbit is anorexic or if it's not eating enough, so just reduced appetite or it's having difficulty drinking, give IV fluids. You can either do it by bolus, or you can, quite often tape giving sets to the rabbit's back like this, so that if the rabbit's hopping about or spinning, the loops that I've taped get tugged out so it doesn't pull my IV line out. However, if it's a rabbit that is spinning a lot, I don't use giving sets in case the rabbit strangles itself, in all honesty. For assisted feeding, we want to be given 10 to 20 mils per kilogram per feed, usually about 4 times a day. Consider prokinetics, metoclopramide and or cisapride. They work in different parts of the intestines. Consider famotidine or omeprazole because they are prone to stress-induced ulcers, and ensure that we've got really deep bedding, a non-slippy surface, calm, quiet environment. Consider putting in rabbit-specific pheromones, appeasement pheromones, which we have. Bayfur make them, and there's another company that I can't quite remember that makes one as well. We've got to remember that rabbits with stress can actually go into acute kidney failure. And that's because rabbits will shut down the blood supply to the kidneys and redirect it to their muscles, which is fine to get away from a predator. But if that stress lasts for several days, you're going to end up potentially in kidney failure. You need to remember that. This is another video. This is really, it'll make sense in a minute. I know it's a baby hack, but it's a really useful method for creating support for spinning rabbits, because all of our owners have blankets or towels and pillowcases. Okay, so they can do this, and instead of a baby in the middle, we've got a rabbit that's needing extra support. We want to be ensuring that these rabbits, if they're recumbent, are getting lots of supportive bedding to help spread the weight evenly, and that we're regularly turning these animals. This was a rabbit who's unfortunately the owner wanted to nurse at home but didn't listen to the advice about turning. This is the rabbit's stifle, and when I cleaned the scab off, its bones were protruding, and that is the point of the hip, the same rabbit. So ulcers are painful and they're difficult to treat once they're there, so prevention is the cure. Support the rabbit up in a normal standing position, and passive physiotherapy of the limbs has been found to be really beneficial. We want to encourage supervised exercise on a non-slip area for 10 to 30 minutes a day, 2 to 3 times a day, because it's been shown to be extremely important for improvement of clinical disease and early return to more normal function. And that's something that the owner can do completely free. Specific treatments for otitis media interna, in addition to everything else I've just mentioned, well, we need to treat the infection, because extension to the brain can result in meningoencephalitis. What I tend to use first line is penicillin injections every 48 hours, subcutaneous. Remember though, if you spill the penicillin on the coat, you need to shampoo it off, because if the rabbit grooms it off, that's oral ingestion, and that can kill your rabbit. But I want to combine it with oral metronidazole, usually about 25 mg per kg, twice daily for at least 4 weeks. Doxycycline or azithromycin are tentative first lines antibiotics. Marbifloxacin or ciprofloxacin in particular is quite good against Pasteurella. Ciprofloxacin I use at 20 mg per kg twice daily. Flamazine flush for otitis externa really can help. That's silver sulfasalazine cream, and I mix it a third cream to 2/3 saline and get the owners to instill in the ear. I'll be completely honest, guys, some real severe cases of otitis media stroke interna need lateral wall resections and bully osteotomy with marsupialization. Okay, it's not without its risks. that is a referral job, I would say, in the vast majority of cases. So financially, that might be out with the reach of some owners. Specific treatments for echiniculi. There's no controlled studies on the treatment of chronic echiniculi. By the time you've got neurosigns, it usually is chronic. But in addition to all the previous mentioned treatments of anti-inflammatories, non-steroidals, that is, analgesia, prokinetics, anti-anxiety drugs, etc., broad spectrum antibiotics are recommended because you usually have secondary bacterial infections. So that could be your TMPS, or Enoflox. And then, based on limited studies, fenbendazole 20 mg per kg for 28 days. But remember, guys, it kills the microsporidium. It does absolutely nothing for the clinical signs associated with the inflammation. And we also need to remember that fenbendazole is not a benign drug. It can cause bone marrow aplasia, anemia, leukopenia, and/or thrombocytopenia. So we do recommend performing weekly hematology checks, and this is me dripping blood out of the ear vein of a rabbit from a 21 gauge needle. Okay. It can also cause small intestinal crypt hypoplasia stroke necrosis. We know that it's metabolized by the liver, so concurrent liver disease might cause increased risk of toxicity. It can cause intestinal inflammation, so that could potentially cause greater absorption of the drug, contributing to toxicosis. And the common clinical signs of toxicity are sudden lethargy, inappetence, gut stasis, petechiation due to thrombocytopenia, pale mucous membranes, hemorrhage, elevated body temperature, and sudden unexpected death. And the problem is, guys, prognosis for rabbits suspected of bendamizole toxicosis is poor. There's only been one recorded case of a recovery. So we really should only be using fenbendazole if we've ruled out all the other differential diagnoses or ruled in an active echiniculi infection. But sometimes, no matter the diagnosis, no matter what's caused it, no matter how hard you try, not every owner will be emotionally or financially able to cope with the care, because this is the real world. Not every case will respond, even if you do everything appropriately. And poor mentation often has a poorer outlook. It's got to be about quality of life, not quantity of life. And having those end of life care conversations is important, because sometimes the owners are considering euthanasia but are too frightened to actually broach it. And how I tend to put it across so that I don't cause offence is I go through all their options and I say, but you know what? At the end of the day, I don't see him when he's at home or her when she's at home. So at any point in this journey, you can say to me, Madonna, this is not what I want for my baby anymore. This is not what I want for my rabbit. I think it's time. And just giving the owner the permission to have that conversation with you can be really, really important. So if we have come to the end of the road and we've decided that we're going to euthanize our pet, the rabbit, remember that many owners will want to stay with their rabbit, and fully explain all the process, the fact they might jump, the fact veins can blow, the fact that they can gasp afterwards or they can twitch. I tend to administer a pre-med. Quite often I'll do a cocktail in a syringe of metatomidine, butorphanol, ACP. And once the rabbit's fully relaxed, I tend to use the lateral saphenous vein or sometimes the marginal ear vein to allow the owners to pat the rabbit at the same time. Don't remove the rabbit to put an IV line in place, guys. There have been studies done that show that removing an animal at point of euthanasia to put an IV line in to then bring the animal back is really distressing for the owners, and often their imagination is way worse than anything you can do. And I get that when we're not confident, we get a little bit more nervous about hitting veins. I don't put IV lines in for my euthanasia as I go off the needle, because I find that easier. I do advise allowing bonded cage mates to see its companion after euthanasia. Anecdotally, they seem to cope better, because although they also grieve because there's been a breakdown of a bond there, they're not looking for the rabbit. They know it's not coming back. It might be anthropomorphizing, but it often will help reassure that your owners that you care. And if your practice offers private cremation for rabbits, or offers a lock of fur, or sends condolence cards, all of those things should be available to your rabbit clients. So this is a recent case that belonged to a member of my team. This is Peaches, and she came in with a head tilt and very quickly progressed on quite severely to more torticollis and nystagmus, but she had otitis interna or mediastroke interna, and there was a happy ending with this one with the treatment, because the picture on the left is her post-treatment, and there is Peaches jumping about quite a thing on her mum's sofa. Thanks for listening. I know I ran on a little bit, guys. I got carried away. Any questions?
Thank you so much, Madonna. What an absolutely brilliant presentation. So as Madonna said, we'll go on to questions now. So I've been enthralled by this, I have to say, through the pictures, the presentations, the videos. So I'm a very visual learner, definitely. So seeing all of those examples of things has been really helpful. So thank you so much. We've covered all of the potential diagnoses for head tilts in rabbits and the other symptoms as well that you might see with these animals. So very educational. Thank you for that. As we mentioned at the beginning, if you have a question, please put it into the questions box on the screen. I know we've had some come in already, so thank you for those. We'll come on to them very shortly. We've had questions about, is the webinar being recorded? Yes, it definitely is. So within the next couple of days, you will receive an email link for yourself. And also if you have any colleagues or contacts who would like to be able to watch back, you'll get your email to be able to watch it back later. And if you couldn't join and you're watching back and you have questions, you do have contact details for us on the screen right now. And Madonna, I know, doesn't kind of hide a light under a bushel. She's quite easily contactable. So if you have specific clinical questions, Madonna's very kindly agreed to answer those if you need anything more specific. CPD certificates for those that have requested them will be sent out as well to your nominated email address. So please use the questions box on the screen to enter anything you need to. I'm just running through them now. So we'll start going to the questions. Oh gosh, there's lots of them. Okay, so let's start.
That either means I was really engaging or I was really rubbish. Apologies for my teeth being in wrong today and stumbling over my words. I get too excited sometimes.
Well, I think, you know, we're in the evening. If we're live, you know, it's now 8:45. I know that you've had a full working day as well, and we've spoken in the last couple of days about you spaying a terrapin. Was it yesterday?
Full slap turtle, yeah.
Yeah, turtle spay yesterday. Yeah. And I have to say that the demonstration of the rabbit twerking, the normal urinating position, it is quite something. But also, again, being super visual, it does make you think, you know, this is what a rabbit does normally. If it can't do that, it must be really significantly struggling. So I think remembering all of those things as part of the holistic approach, you know, we've talked a lot about medication, about veterinary care, about nursing care, and also for support staff as well, working in practices, and for owners at home as well, all of those practical things that you can do to help these rabbits out when they're so uncomfortable. You know, as you mentioned, as a prey species, quite often they're quite far down the line before you start seeing these, you know, these symptoms demonstrated. So all of these things are super important, and we have owners who are very conscientious and notice these things quickly, and some of them only get presented as a bit of a last resort, you know, so we have to remember that as well. So let's, without further ado, go on to the questions now. So I'll start from the top as they've come in. So our first question, Madonna, is: do you agree with advice that every rabbit should be treated for possible echiniculi in order to avoid later illness? Some vets may not agree.
No, I don't agree with Do you mean, sorry, read that one more time for me? That
Okay.
do I agree?
Do we agree with the advice that every rabbit should be treated against possible echiniculi? So I'm not sure if that means in the general population or if it means in with clinical signs, but if you'd like to comment on both, perhaps that could be useful.
Yeah. So no, I don't agree that every rabbit should be treated. Every seropositive rabbit should not be treated because it may be seropositive but not have any infection. Because it still maintains their IgG. Some of them will maintain the seropositivity for life, and it's not a benign drug. I think if it was a benign drug, when I first qualified from university in 2002, I was under the impression that fenbendazole was a benign drug, so I would have happily dished it out. And then, you know, why not? Ain't going to do any harm and potentially could do some good. But now that I know, and I've seen problems in reptiles and birds, I've seen them dying of fenbendazole toxicity. I give it if I have to give it. So just because it's been exposed to echiniculi doesn't mean they still have it. Treating all pet rabbits with fenbendazole, I know that the licensed fenbendazole, the box says give it 4 times a year. Nonsense, in my opinion, because you don't know. Yes, it can prevent if they've been exposed or they're being introduced to a new rabbit. In theory, if you give that fenbendazole, you can prevent it getting infected that one time. And then if the rabbit's going outdoors and it's getting exposed potentially to wild rabbit urine, then it's going to get reinfected. If the owner is going around to their pal's house and walks that they have rabbits and they walk over and take spores home in their shoes. So no, I agree with treating with fenbendazole when I'm highly suspicious it's echiniculi. I know as a young vet, when I first qualified and did rabbit medicine, if I saw a rabbit with a head tilt, I treated for both. Not going to lie. But I'm also a believer in once I know better, I try to do better. And once I learned more about the pathogenesis, once I learned more about the difficulties and the potential toxicity, then I try much harder now to try and figure out exactly what it is or the likelihood of what it is before I give the treatment. Hopefully that made sense and I wasn't too rambling.
It certainly made sense to me, so I hope that to the audience as well. And if the audience have any further questions on that, please add it in. And I think your reassurance at the top of the webinar that, you know, this is it's a mammal, you know, we don't see as many of them as the others, but they have the same, you know, physiological features as others. Don't panic, you know, have a systemic approach, work it up in the same way as you do with your other cases. You know, start at one end, perhaps, you know, some of your approaches are different as you really helped with those practical points about how you handle going to the rabbit rather than bringing it to you. I really liked the idea of putting it on the table, you going down and becoming, you know, at face level with it will give you a really good indication of facial changes. And the substrate or what you have on the table for them as well to make them feel more comfortable. I think those are things that in a busy consult session can be easily forgotten, but as a whole veterinary team, everybody can contribute to ensuring that rabbit medicine is performed to the same high standard as cat and dog medicine. So thank you for that. That was a really detailed answer. We've got some more questions about the treatments that you mentioned as well. So do you use pregabalin as analgesic in rabbits, and if so, at what dosage?
Oh, that's a good one. Short answer is no, only on the basis I've not had to. I have heard of colleagues that have used it. We've not used it in our clinic. I don't know the dose, but I will find out. So if whoever asked that question can send Lisa your contact details, I will find out for you. I've always had, for my neurogenic pain relief, I've always had effectiveness from gabapentin, so I've not had to go to pregabalin. However, for myself personally, GABA didn't agree with me, so I've used pregabalin personally when I had spinal issues. But yeah, I'm quite happy to do research into that, not a problem.
That's brilliant, thank you. So yes, we've got the details for the person that answered that question, so we'll be sure to follow that up with you. So thank you for that. Next is, please can we repeat the dosage for paracetamol, gabapentin and omeprazole?
Okay, so paracetamol is 20 to 25 mg per kg, 2 to 3 times daily. What was the other drugs?
Paracetamol, gabapentin and omeprazole.
So gabapentin 10 to 30 mg per kg, 2 to 3 times a day. I've had loads, like hundreds and hundreds of rabbits on it, and I've had 3 that got stoned on 10 mg per kg, and I had to drop them down to 5 mg per kg. The rest of them did absolutely fine. Omeprazole, give me a second, because my H2 of choice is famotidine, and I remember the dose of that off the top of my head. It's that's 0.5 mg per kg once or twice daily. However, I have a handy app on my phone, so I will look up the omeprazole dose for you right this second.
Fantastic. While you're just doing that,
yeah, you ask another question. Well,
we've had lots of thank yous about the fantastic presentation, the videos and all of the practical help. So I can only echo those. We were planning on finishing at 9 p.m, but we checked with Madonna, because often our webinars are very well subscribed and have great engagement, and Madonna's kindly agreed to continue past 9 p.m. with questions. We never want to stifle healthy discussion. So if anybody does have to leave at 9, the recording will have all of the Q&A session in its entirety. So if you have to go and you've got a question, I assure you we will cover all of them. So don't be afraid to ask a question, even if you can't stay with us to the end. So hopefully, Madonna, that's given you enough time to answer that one.
It did, thank you. 10 mg per kg, once or twice daily.
Okay, that's brilliant, thank you. And don't forget, you will be sent the link to watch back as well. So obviously the presentation had all of those dosages in as part of Madonna's slides. So if there's something that you need to have to refer to watch back, you'll be able to see that. So a practical question now, Madonna. Any tips for otoscopic examination in rabbits?
Yes. So bunny burrito every time. Wrapping the rabbit up snugly in the towel and getting somebody to hold the rabbit. Using, if you've got an endoscope, and by endoscope I don't mean a big fancy thing, I mean one of these Amazon cheapy shots can sometimes help. Sometimes they can be quite good because they're quite fine, so you can look down and the owner can then see it. In the conscious rabbit, you're very unlikely to visualize the tympanic membrane. Okay, so don't worry, you're not doing it wrong, because that's what I used to think when I was a younger vet. It's not that you're doing it wrong, it's just due to the rabbit's anatomy. They only really have a vertical canal, but it's very long and it gets very narrow. But I tend to use the medium cone for most things in my clinic. And that gets me down deep enough to see whether I'm getting inflammation in the ear canal or not. And it's just like looking at a dog or cat ear canal. You'll get the pale pink, and then it'll start to go darker pink, and then you'll get splodges of red where you've got erosions and ulcers. And when you look in the ear, often when you've got your ear-based abscesses or ear-based swelling, sorry, when you first look in with your otoscope, you might not see anything because it's too deep down. Then you squeeze the swelling, the rabbit will get upset with you because it's sore. And then when you look back in, you get this tube of white paste coming up, okay, which is a mixture of pus and wax. It's lovely. Not healthy. Healthy rabbit wax is actually pale toffee coloured, but you can sometimes get a creamier form of it. And if you are a real geek, then what you can do is make a smear of it and dip quick it and to look to see, or is it pus, or is it wax? Because if it's pus, you're going to have degenerative white blood cells.
Okay, that's brilliant. Thank you. Lots of practical advice again, and I think we've all probably experienced the rabbit pus and the joy of that. So it's not usually mistaken for anything else. And apologies for anybody who might still be eating at this time of night.
Sorry.
Yeah. I think that's what we came for, really, though, isn't it? You know, we're all here to learn about these things. And I really like the hint about the, you know, getting your kit off Amazon as well. You know, we don't need to go down the route of lots of very expensive kit, that it's accessible to all, to make your clinical examination much better, where you, you know, where you want to really approach these things properly. Next question. So what, if any, I think we covered this partly actually, when you're talking about euthanasia, this question came in during the webinar, you recommended sedation.
Yes.
So what would be your drugs of choice in your experience for sedation before euthanasia, Madonna?
I tend to use metatomidine, butorphanol and ACP mixed together in a syringe, and I often give it subcut. I mean, you can give it IM, but they have small muscles, relatively speaking, although they're very powerful muscles, and it hurts. Intramuscular injections hurt. And I don't like causing pain at any time, but certainly not end of life. So I'd rather just give a much bigger volume for it to take effect faster, and do it subcutaneously. A lot of people get really worked up about the dose, the actual dose, but at end of life, you're letting them go. You can't overdose them. You can't overdose them. So, and we have to also remember that if that rabbit is really stressed, then the adrenaline is going to burn through your sedative. So it wouldn't be the first time I've had to top up a sedation. But let's be honest, we have to do it with dogs and cats. You know, because we pre-med everything in our clinic before we euthanize. And if we've got an animal that is really fractious or in a lot of pain or just terrified, they burn through our pre-meds. They do it before surgery as well. Sometimes we have to top them up.
Okay. And do you have a set amount of time that you would allow for your sedation to work? What's your guidance around that?
Oh, that's a good question. Most of them will be asleep within 5 to 10 minutes with the sedative. As a rule of thumb, for a 2.5 kilogram rabbit, I'll use 0.3 mils metatomidine, 0.2 torb, so butorphanol, 0.3 mils ACP, and they'll be sleepy enough, usually in 5 to 10 minutes on average. You'll get some that'll take a bit longer, some that'll be a bit less.
Sure. Okay. I think for anybody that just hasn't experienced that, just to know what to expect is really handy. But yeah, I think we looked at in the presentation about the owner's perspective of these things as well, and we know that often it's their last memory of their pet, and it may be their last visit to the practice. So anything that we can do to make that visit better for the owner and make the journey better for the rabbit has got to be a good thing.
Yeah, and not only that, from the practice's point of view, so if you've got any of you that are having to speak to clinical directors or owners of practice, there are studies out there that have shown that if an owner has a negative or an adverse experience during a euthanasia, and that can be, to us, not appear to have been adverse, and that could be you taking that animal away out the room and they're imagining all sorts happening, they're very unlikely to go back to the clinic ever again with their next animal. So you lose a lot of clients that way. Whereas if somebody has had as empathetic and caring an approach to an end of life consult as possible, they're much more likely to want to come back to see you with their new animal, because they feel that you treated their animal compassionately, but not only that, their grief was seen and heard and understood.
100%, yeah. I'd imagine that most of the audience are pet owners as well, you know, and have had the misfortune to go through the euthanasia. But we know it can be an absolute blessing. We know that we have the luxury of euthanasia in the profession. And your points around the communication as well, that sometimes it's not too early to open that door, you know, to say to people, if this isn't what you want, then that's a choice for you. And it may be that the owner will say that, you know, they're happy to commence treatment, you know, to start with something, but then to raise that point again at some point later, you know. We can't anticipate what an owner's thinking or what their budgets are, but I think, as you quite rightly mentioned, sometimes you need to bring that up for them. They don't want to think that they're saying it too early, but having the opportunity to agree with you can be really valued. So communication, like so many things, is absolutely key.
A lot of owners are frightened, in my experience, to bring it up, because a lot of owners are worried they're going to be judged by their vet, and their vet opinion matters to them. But framing it in the right way really helps. So, you know, just saying, look, I'm not saying you should do this, but just please remember that at the end of the day, this is your rabbit. At any point, you can say to me, this is not what I want for my pet anymore. That they just don't have the quality of life that we want. And you've got that power to make that decision. Power is maybe the wrong word to use, but you know, you've got that ability to make that decision, and I'm not going to think less of you for that. There's no right or wrong answers here. There's right and it's what's right and wrong for you.
Absolutely, and I think as well the point that you made around you don't see what this rabbit is like at home. You see them when they're in the consult room, so their normal behaviour, what's good for them. It is really powerful. So if the owner, in their judgment, feels that things have changed, the quality isn't there, then yeah, judging the quality in the days, not the quantity of the days, is very valuable. Okay, let's move on. We've got more questions to cover. So, do you use and think metamizole, I'm sorry if I haven't pronounced that correctly, has a role in pain management?
Metamizole. I'm having a brain fart. Metamizole. Oh, sorry, that's one a Madonnaism.
It's one that we can all relate to, I'm sure.
Yeah. Give me a second while I Google it.
Okay.
Oh, no, wait a minute. Yeah, the metamizole. Metamizole I'm getting is a hyperthyroid treatment. So no, I've not heard of that being used as a pain management.
Okay, so
unless it's another drug that they've meant. I know there's something beginning with an M that is used as an appetite stimulant in cats, but it's been shown not to work in rabbits as an appetite stimulant. So unless the delegate's meaning that, but of course it's out my brain as to what that drug is. But if the delegate's still listening, please, you know, shoot Lisa another message so that I can make sure I get the right information for you.
We're keen to cover everything, and if I've missed something in translation, then my apologies for that. But yeah, if there's a question that you would still like to submit, we're happy to continue. So don't be afraid to ask about treatments, about management, about any cases that you've seen.
Could it be mirtazapine? Mirtazapine is a mirtazapine. That's the name of a drug in cats that's been shown to be an effective appetite stimulant in cats, but it was a paper that showed it wasn't effective in rabbits. I know I still see it online in forums where vets recommend it. I've never used it on the basis of the paper that said it wasn't used. It didn't work.
Okay.
But I have no clinical experience
of using it. Yeah. Thank you for that. So we've covered two for the price of one there. Next question: how often do you see toxoplasmosis in rabbits?
Ooh, good question. It's not common. I've never personally knowingly seen a case. That could have been due to my ignorance of not knowing it was an option years gone by. In all honesty, I have colleagues that have seen it down south. I suspect it's underdiagnosed, but certainly in literature it's classed as very uncommon.
Okay, thank you.
But I believe you know, teeters or PCR, and I think your pocket kit does toxo.
Yeah, indeed, yeah. So when we were putting together the literature, when we got the caniculi test for pockets, I did some Googling, to be honest, you know, as well as some slightly more in-depth research about what things are seen in rabbits. So on our list, we have E. caniculi, we have toxoplasma, we have also things like salmonella, rotavirus, etc. And some of these things are seen commonly, and some of them are seen incredibly rarely. But I think it's good that we've mentioned them. So if anybody's interested in looking closer at in-house PCR testing, then do please get in touch. But I think we also have to put the caveat there, as Madonna said, that E. caniculi certainly is not the easiest thing to pick up. You know, so even with the best PCR kit in the world, if you haven't got it in your sample, then it's still going to give you a negative. So looking at the whole picture is still absolutely key. So we'll continue on. So please, can you tell us what the app is for drug dosing that you mentioned? Especially
yeah, the drug dose. Okay, it's my Kindle app because I downloaded. So there's lots of good books in the market. But one of the ones that I use is Carpenter's Exotic Animal Formulary, which is I think it's in its 5th edition, and I have that on my Kindle. So that was the particular app that I was using there. I'm not very good at self-promotion. I'm trying to get better at it. But in September, my first textbook is being published, and it has all. So for every species, I've done a literature review. So each species from the small mammals, I've literally read between 80 and 90 research papers, and between 4 and 6 chapters of textbooks on each species, to try to provide the most up-to-date scientific-based dosing possible. I should say that most of the drugs that have been mentioned in this talk are not licensed for use in rabbits. Okay, so depending on where the delegates are, they need to adhere to their prescribing laws. For us, it's the Cascade, a lifetime Cascade form. So that book, which will be, I think the title is now going to be Exotics Made Easy: Demystifying Rabbits and Small Exotic Mammals for the GP Vet, and all the doses will be in that, as well as all of the reference ranges for biochemistries and hematologies.
That sounds like it will be an invaluable resource.
But Carpenters, I love Carpenter. That is yeah, for all my species. I do love Carpenters. It is the Bible for formularies.
Excellent. If you're using it, then I'm sure that our delegates would also find it useful. So thank you for the heads up, and absolutely, yes, when your book is out, then we'll be looking out for it. On to the next question. What is your approach if the rabbit gets anemic or other side effects from treatment with fenbendazole during treatment for E. caniculi infection? Do you stop?
It's an interesting question. The studies that was done, only one rabbit survived, even with blood transfusions. Anemia, and I think that's why your baseline hematology is really important, because anemia of chronic disease is quite common in a lot of species, including rabbits. But if you get bleeding gastric ulcers, you could potentially have anemia as well. But low white blood cell counts are really uncommon. Thrombocytopenia, really uncommon. In fact, I would say rare for both the last two in rabbits. So if you noticed on those weekly tests that those counts were dropping, I would stop the fenbendazole completely, because there's been no study that has shown the usefulness of fenbendazole in treating chronic cases. So we know that it kills the parasite, or not the parasite, the microsporidium, but it does nothing for the inflammation. It's the inflammation that's causing the issue. So yes, we want to get rid of the microsporidium, because then we're not getting more spores released and not continuing on creating more inflammation. But if we, I think there was one study that showed up to 10 days fenbendazole was associated with better recovery, but after that there was no difference.
Okay.
I've got all these references I can send to people if they're interested.
Okay, so if you are interested in further references, then please do get in touch. My email address is on the screen now, and as we mentioned, you can also access Madonna through the usual routes. So if you want to know more, please do. But yeah, thank you for the advice on that. And I think, it was very clear from the presentation that treating the symptoms that you're presented with, is obviously the owner's first concern as well. So ensuring that you're covering all of those bases. As I've gone down the list here, I've been told metamizole is an NSAID. So that was one.
Metamizole. Oh, it's not one that I'm familiar with then. Metamizole.
METAMIZOL. And then I've got it spelled once with an E on the end and once without.
Sorry, say that again. METIMAZOLE.
META.
Oh,
Apple,
sorry.
AMIZOLE. METAMIZOL.
Oh yes, yes. I've not got any experience using it. I have read about it being used, but I've got no experience in using it. However, in rabbits, but I can look into it. But yeah, no, I recognise it now, but I've just got no experience in it.
Okay, thank you. And along the same lines, another question: can we use meloxicam?
Oh yes, that's my NSAID of choice. Love meloxicam, and the vast majority of rabbits will take it quite happily. I've got some beautiful videos of the rabbits coming running as soon as the owners rattle the box. So yes, meloxicam 0.6 to 1 mg per kg twice daily.
Okay, excellent. There are still more questions coming in, so Madonna, if you're happy to continue, we've got great feedback. I'm loving the dialogue here through the Q&A. So Google says it's banned in the UK. I'm assuming that's relating to one of the drugs we've mentioned. I don't know if that's the NSAID.
That may be why I've got no experience of it then.
So could well be. So perhaps that's why.
Thank you for that one.
Yeah, why I know we've got some international delegates have joined us. So thank you very much for the questions and for the information as well. Next one is, I guess this is related to the stress response that you talked about as well. So do we see flare-ups in E. caniculi when vaccinating rabbits?
Ooh, not that I've read about anywhere in the literature, not that I've ever experienced. I think in my clinic I have a big pile of clean blankets, usually towels to be honest, on the bunker, and every new animal comes in, once I've disinfected the table, gets a clean towel down. So minimising the stress for the visit, having your front of house team trained so that if there's a big barking dog in the waiting room, then the rabbit can be moved to a quieter part of the practice and the carrier, remembering that just because the rabbit might be housed with a predator and is seemingly okay with that owner's dog and cat, it's okay with its own dog and cat. It's not okay with every dog and cat that's out there. Educating owners how to carry the baskets, so carry them, carrying them like this and not by the handle, just the way you do with cat friendliness, yeah? Because if you carry it by the handle, the animal's quite happily, quite unhappily being swung about. Whereas if they're carrying it by either end, the rabbit's a lot more stable, ensuring that if the owner's coming to the clinic, they bring the bonded pair. They don't just bring a sole rabbit, because keeping them together helps them feel safer, reduces their stress. Because it might be the rabbit that comes to clinic's fine, but the rabbit that's left at home is totally stressed out its box, and that is could be a stressful incident for that rabbit. We've got to remember they're all individuals, and just like we get some people that are like Bob Marley and completely chilled out and don't care about anything, take everything in their stride, and then you get people that a gust of wind can set them off and they're really anxious and they're really highly strung. It's the same with rabbits. You'll get some rabbits that you could do practically anything to and they'll still bounce out and give you a head nudge and a
Oh, we appear to have lost Madonna for the moment. She's frozen on my my feed here. I don't know if she's frozen.
And then you get rabbits that you look at them the wrong way and that's it. They're thudding and they're, oh, there you go. Oh, pet remedy spray as well on the towel helps if they're stressy.
Excellent. I did know that you alluded to the pheromones as well, so the rabbit equivalent to Feliway. So what's your advice about the use of those?
They seem to work really, really well. I tend, in all honesty, I don't use them in my clinic. The reason being is I have a prey species ward. It's not just rabbits that's in my prey species ward. So I have a pet remedy plugin, but I have a pet remedy plugin in all of my wards because that pet remedy, for anybody that's not aware of it, has been shown to be clinically effective at alleviating signs of stress in multiple species. But for rabbits that are housed at home, or the owners doing the nursing at home, then I do recommend that they buy them. And the feedback that I've had, because they've not been available for that long, that the feedback I've had from the owners have all been overwhelmingly positive.
Okay, that's great to know. Thank you. That's the end of the questions I've got on my screen at the moment. So this is your last call for questions. For those that have stayed with us this long, thank you so much, and for your engagement so far as well. And the dialogue in the questions. We've all learned things. You see, Madonna said every day is a school day, so we've all learned things. So anything else, please pop it in the questions and answers now, but I think we probably are drawing to a close. So I think that probably just leaves me to thank Madonna again for her fantastic presentation, for all the videos, for the effort that she's put into preparing and speaking with us after the end of a long day today. I also need to thank my HORIBA colleagues. This wouldn't happen without them. There's a lot that goes on in the background, making sure that all of this is organised, that the videos work so you can get to see them, and pulling together everything from the publicity to sending out the CPD certificates afterwards. If you've enjoyed the webinar, please feel free to pass on the link to any colleagues or contacts who would like to watch it back. It will be hosted on the HORIBA website, so you'll be able to view it back either via your link, or you'll be able to go and find our other content there as well. So there's a whole range of webinars across small animal. There's equine strangles, there's subclinical hypocalcemia in dairy cattle as well, if you have any farm work going on. But we have a range there on different subjects. If there's something that you have a burning issue to learn more about that we can present on, then please do let me know. It's always great to have that engagement from the audience. You'll also see on your screen now that we're attending some more events later this year. We've got BVA Live coming up in June, BEVA in September, and we'll be at London Vet Show. So if you want to see our PCR system or how it works, visit us one of the shows, or get in touch via the website or my email address. I'm very happy to come and see you, demonstrate the system, and see if it might be of use to you. We do a lunch and learn kind of a discussion meeting. If it's not for you, you'll have learned a little bit more. You might have got an hour's CPD, and we can still be friends afterwards as well. So Madonna, we haven't had any more questions come in. I think we've been very comprehensive this evening, covering the head tilts, the tears, the runny noses, the spins, the paresis, the peeing, the pus. So thank you so much again. It's been brilliant presentation and brilliant engagement from our audience there. So to everybody who's joined us either live or afterwards, thank you again. And stay safe. Have a good rest of your day.
Thank you.
See you again. Bye-bye.
Bye.